and thank you for joining us for our panel this morning. We're still in the morning, which we will be discussing studying osteopathy. I would like to acknowledge the traditional custodians of this land on which we meet, the Widjabul Waiable people of the Bundjalung Nation, and pay my respects to elders past, present and emerging. I'd also like to acknowledge that within and without the buildings, this land always was and always will be Aboriginal land. My name's Ellen Fleeton. I'm a Future Students Officer at Southern Cross University at our Coffs Harbour campus, but I've driven up today to be part of the panel. So really excited to be here, and thank you for joining us. And thank you so much to our amazing panel members for joining us. So what I might do is get you each to introduce yourself and describe your connection to Southern Cross University.
Well, I guess I'll start.
That's right.
My name's Sarah McPherson, and I'm one of the lecturer practitioners for osteopathy, and I'm based out of Lismore. I also have connection to SCU, as I was part of the first cohort of students to actually study and graduate as an osteopath from this university.
Wow. Can I ask how long ago that was?
A while.
Thank you. Good to know. And Andrew, could you introduce yourself?
Hi everyone. I'm Andrew Fife, final student at osteopathy in Lismore. I've really enjoyed being in Lismore. It's been a bit of a journey, but I think now I'm getting close to the end. I've been looking back and reflecting. I'm enjoying it, and it's been really good to get to know more about the human body and deal with the Lismore community.
Awesome. And Angela?
I'm Angela Slattery. I'm a recent graduate from SCU. I graduated February of last year and was one of the first students to go through the new 4-year osteopathy course. And I currently run a business in Lismore and also lecture at SCU.
Wow, that's, super cool. Lots of connection there. Sarah, I'll start with a couple of questions for you, if that's okay. Now, this might sound like an obvious question, and I'm sure you're very well versed in answering it. So Southern Cross University is one of just 3 universities in Australia that offers studies in osteopathy. Could I start by asking you to briefly explain what is osteopathy and what do osteopaths do?
That is a very common question, but there's quite a big answer, but to bring it to a short answer, osteopathy is a holistic method of diagnosis and treatment of musculoskeletal and functional issues in the body. So we look at the whole person rather than the sum of its parts.
And how is it different to chiropractic or physio?
Mainly that comes down to our philosophy. So chiropractic is focused on malalignment of joints or misalignment of joints with a lot of focus on the spinal column, whereas physio is very movement focused and do a lot of injury management, where the difference, as I said, with osteopathy is we look at the whole body rather than just the sum.
Awesome. And how do you actually become a practicing osteopath? What's the pathway?
So to practice, you would, especially at SCU, you'd be required to complete the Bachelor of Clinical Science with Osteopathic Studies as a specialisation. And then to practice in Australia as an AHPRA registered osteopath, you will be also required to do the Masters of Osteopathic Medicine.
Awesome. Angela, I've got a couple of questions for you now.
Sure.
Could you tell us briefly about your career and your role now, and what's the most enjoyable aspect of it?
So I originally started as a massage therapist at the age of 16. I continued massage therapy throughout my studies as an osteopath, which gave me experience in manual therapies. From there, since graduating, I've progressed more into treating osteopathically rather than with the soft tissue treatment. So a lot more joint manipulation and trigger point therapy with the addition of extra courses in dry needling and aromatherapy. And since graduating, I've opened a allied health practice in Lismore, so I practice as an osteopath there, as well as having more osteopaths, massage therapists, psychologists, nutritionists, and women's pelvic health specialists in the clinic. And then I also had the opportunity to assist in teaching last session at SCU, and from there I was offered a position to teach a class on my own this session.
Awesome. And you sounds like you're juggling many different hats. What's most rewarding about the things you get to do?
Most rewarding is the treatment aspect of the practice and getting to assist people in ways in which they've kind of been through every other health professional without diagnosis or any clear treatment plan, and then they come and see us and get results because we tend to look at things from a different aspect. I also love the mentoring aspect of teaching as well and assisting future students in developing their career and their style.
Yeah, it sounds like a very holistic and rewarding career.
It really is.
So you talked a little bit about the treatment that you do. Do doctors refer people to osteopaths, and who are the most common patients that you would see? Or do you even call them patients?
We call them patients, and we do receive doctor referrals as part of chronic management plans. So we do get quite a few of those through the clinic. Most of those patients that we see are elderly patients or patients who've experienced traumatic injuries with no resolution who benefit from osteopathic treatments. In our clinic, we have a variety of ages. We range from newborn to late 90s. So we have the ability to treat many different conditions.
Awesome. And do osteopaths work in hospitals, or is it mostly private practice?
At the moment, it's mostly private practice. There is opportunity for osteos to work within aged care sector, so alongside osteopaths and physiotherapists. Many of my colleagues have gone on to do that, and that's also really rewarding and a little bit more permanent than heading out and trying to do it on your own.
Yeah, I can imagine there'd be many benefits but also challenges of private practice for our osteos. This is a bit of a loaded question, or interesting or juicy, I don't know. What's the average annual income or salary for an osteopath?
That is a very loaded question.
How much money can we make?
I want to know.
I know you want to know. It really depends on what you want to do with your career. I've always said to anyone coming out of osteopathy, don't treat health services as a career in which you plan to earn money. I work because I enjoy it. For me, work's a hobby, money's a bonus. And it depends on the hours that you want to work. I've seen people head into practice doing 8 or more hours a day, treating 16 or more patients a day, which is quite full on and rewarding in its own way if you want a high cash flow, but you can achieve burnout really quickly. So it's a fine line between juggling cash flow and your own health.
Yeah, and I think that's a really important point with whatever career pathway you take, is maybe not looking at it as a money maker and more what your life's going to look like long term. I think that's really good advice.
Absolutely. And with osteopathy, because we can go anywhere in Australia and our course is also recognised in New Zealand, we have the opportunity to travel. There's no osteopaths further out west. That's highly populated in the areas in which the course is offered. So anyone that wants to head out west and is able to create a practice out there would find it really highly rewarding as well.
And what sort of advice would you give to anyone considering studying to become an osteo? And what sort of traits do you look for as an employer?
Those are both good questions. So recommendations for people wanting to study is be prepared for a lot of science. Science is very full on in this course. It's a very fast-paced course. It takes time and patience to get through everything. I did most of this course as a single mum as well, so it is achievable to pretty much anyone if I can do it. And traits that an employer might look for is just being yourself and being able to talk to patients is probably the biggest thing. So get comfortable with talking to people.
That's great advice that could be relevant to lots of different industries as well. Andrew, I've got a couple of questions for you now. So professional placements are a big part of this degree, correct? Providing you with approximately 100 hours of experience at the bachelor's level and 580 hours at the master's level. Is there a choice of where you go, and what did that look like for you? How did you sort of navigate all those hours of working for free?
It was tough. I went through the bachelor's when COVID was happening, so we had to do it mainly in the health clinic here in Lismore, but I think there is option when things are back to normal to work at Pharaohs, I think, is it right? Is that right?
Yeah, for one of the placements for osteopathic diagnosis, yeah.
Yeah, so you can choose to work in an aged care facility. And in the master's program, you have external placement. So you get to choose, I think, 12 hours per semester to work with an osteo of choice. And then you do the rest of the hours at the clinic.
Can you explain for the people in the audience how the SCU Health Clinic works and what that's like?
As a student, you spend 5 hours per shift, and all the booking services are made through the clinic at Lismore, and patients from the community come in, and we sort of problem solve at our best ability, and that's, I think, where we learn the most.
Yeah, I have heard that a lot with osteo students, that it's actually in that clinic on campus where they're learning all their skills and honing those skills and sort of building themselves up to get to where they want to be. Would you agree with that?
Absolutely. It's where basically all the knowledge gets consolidated from the first few years of study. So when you get to the point where you're a treating osteopath within the SCU Health Clinic, you're normally at the level where you're either at the very end of your bachelor or at the beginning of your master's. And by that point, you're ready to take all the science that you have learnt in your bachelor and put it together. And you do that under the supervision of a registered osteopath.
Awesome. Andrew, what advice would you give students who are thinking about enrolling in this degree?
I think if you enjoy the human body, have a sort of caring nature and want to help people, and are a problem solver, choose osteo.
And where are you hoping to go after you graduate? What's your plan?
That's a good question. I'm not sure yet. I'm just worrying about getting through this last semester, and then I think I have about 5 months of clinical hours to complete. So then I'll sort of sharpen my direction a little bit more.
Nice. And do any of the panellists have anything else that you think is important for people who are exploring this study or career path to know? Anything we haven't covered?
I think it's also important to know that there's other pathways as well to enter the osteopathy course. So if you want to be guaranteed a place in the Bachelor of Osteopathy, you can also go through the Diploma of Health pathway, which is sometimes a little bit of a softer landing too, if you want to make sure that health is the right direction for you.
Yeah, that's a fantastic point. And we have our study advisors here, the lovely ladies in the greyish purple polos. So if you have an individual question about your own application or enrolment, they're the experts, they're the people to speak to. But there are a million different ways into university, and finding the right pathway for you is something that we're really passionate about at SCU. So I don't have any more questions for our lovely panel, but I would like to ask our audience members if you had anything that you were wanting to know about the degree that we haven't touched on yet.
So obviously the flood was devastating for the entire community for various reasons, and also I don't know if you've noticed the amount of demountables around the area on the campus at the moment, but we've also been kind of a refuge for a lot of places that had nowhere to go. So we have schools that are here now, we have other PHN health facilities that are running out of the SCU Health Clinic, and we're also an evacuation centre at the time of the floods. So whilst that was going, yes, we did have to put a pause on student-led clinics, but we were working towards ways to get students to be able to catch back up on their skills and their clinical hours and assessments to get them forward.
To sort of add to that, we had the option as well to go to the Gold Coast campus. So if you didn't want to wait, I think we waited 6 weeks, you had the opportunity to go up there. And the students in Lismore that decided to wait, they just did 2 classes a week. So, they still got what they needed from, I suppose, having time away.
Absolutely, and as some of the students were also directly affected themselves, some of them actually needed that time themselves to regroup. And as Andrew said, there were opportunities for them to travel to the Gold Coast to stay on top of their studies if needed.
So for me, as far as the clinic is concerned, my clinic is in town in Lismore CBD. We were fortunate enough to be just high enough that the water didn't get us, so the water was 1/2 metre below our floorboards. Unfortunately, we had a lot of people within the area who weren't as lucky, so we were without power for 6 weeks. I personally rented a room from a chiropractor up in Gunnellabar for those 6 weeks and did 1 day a week just to keep in contact with my patients. Following the flood, when we reopened, we had available space to add psychologists and counsellors to our rooms that we had vacant. So we currently have increased staff at the moment at work to help with those services.
full-time and part-time studies is something that, students really want to get their head around. So, Andrew, I'll ask you first. Did you study full-time or part-time?
Full-time.
Full-time. And how many hours a week does that look like for you?
That's a great question. I think if you look at it, let's say you have 4 units full-time, try and spend at least 3 to 4 hours a week on those units outside of uni, just to keep up with the progression and also make sure you're on top of those things.
Yeah, and what we like to say as a blanket rule is full-time study is like a full-time job, so you would be looking at committing about 40 hours a week to that, and then part-time study would be like a part-time job where we would say about 20 hours per week. However, in the osteopathy degree, because of the placement requirements, you do sort of need to be committed to be able to fulfill those hours. Sarah, is there an option to do this degree part-time?
There is, but that would be a conversation that on enrolment would be best had with our course coordinator as well, to make sure that you're planning the best pathway and the best units to support your progression through the course.
Yeah, and just on that as well, with the full-time study load, we often find students still have time to work between 10 to 15 hours a week to support themselves and have a half-decent social life as well. So it is different to school because your timetable is a lot more flexible, but you do really need to be committed to those 40 hours a week for full-time study. That's a great question. Early entry is available for all of our degrees except midwifery. So yes, you absolutely can apply for osteopathy through early entry. We encourage you to do so. All right. What we might do is wrap it up now. So if you haven't already, speak to our study experts about getting your application in. We wish you all the best with the rest of the year, and we really look forward to hopefully welcoming you to our lovely university community here at Southern Cross. And I would just like to say a massive thank you to our amazing panel members. Thank you for making the time to be here today on a Saturday. I've really enjoyed, and I've learnt a few things myself.
It's been our pleasure. Thank you for having us.
Thank you.